We're here with Reinhold today, who's an 82-year-old gentleman who's had a UroLift procedure, and thank you for coming today. Tell me a little bit about what treatment you had tried in the past before having any UroLift procedure or thought of a UroLift procedure.
Originally, I tried Flomax medication.
Mm-hmm.
That didn't work for me. My heart was not too happy about it. I couldn't tolerate Flomax, and we stopped that. And I just went on living with my symptoms.
Tell me a little bit about your symptoms that you were having that became bothersome for you. What were those things that really drove you to the point where you said, I got to do something?
The most bothersome symptoms were frequency and urgency of urination.
Okay. And were you having frequency at night also? Getting up frequently at night?
That was the worst part.
How many times were you getting up at night, do you think?
Up to 4 times.
Okay. Tell me about what attracted you to doing a UroLift.
I liked your certainty and your experience with the procedure. There was no full anesthesia required, only
Which was
local
important.
anesthesia. That was important to me.
What was the day of the procedure like when you actually had the procedure? Tell me a little bit about your comfort, the length of the procedure. Do you have any remembrance of that time?
The procedure was smooth, efficient. I've had no pain, no discomfort, no pain during the procedure whatsoever.
And what was your recovery like after the procedure, before you saw me in follow-up? What was it like?
I started feeling better right after the first week,
After the first week, you started feeling better.
significantly better.
You could tell the difference in little as 1 week.
Yes.
Okay.
After that, each week made a major difference. For a complete recovery, took me maybe a month.
So it only took 4 weeks for you to really get to the point where you've stayed at, really.
Well, my symptoms were improving so much that I would say I didn't feel as good as when I was 20, but
Right.
when I was 40.
Yeah. So close to when you were 40 years old. So you went back 40 years in time or so. How many times are you getting up at night now?
Optimum 0, and mostly once.
That's great.
I get up once, and rarely twice.
And how's the flow? Is it strong?
The flow feels normal.
Okay.
It feels strong, and there's no dribbling, maybe a drop or two, but not the way it was before.
That's great. And then you were really bothered by a lot of urgency where you had to rush to the bathroom. How's that now? Can you sit through a movie if you had to, or a meeting if you were in a meeting?
Yes.
That's great.
With reasonable limits.
Uh-huh.
There are limitations, of course,
Yeah.
but I don't have to rush to the bathroom right away.
So we appreciate you coming here. Would you be willing to share your story with other people and other patients so they can be aware of this procedure? For instance, on the internet or on our website, would you be willing to do that?
Definitely.
And if you had to do it all over again, would you do it all over again if you had to?
I wouldn't hesitate a minute.
We're super happy that you had a great outcome and that you shared your story with everyone. So thank you very much. Appreciate
Thank you, Dr. Hopkins.
You're super welcome.